700 staff members work within the four walls of the KHMH Memorial Hospital. KHMH has the largest population of employees under one roof in the country. This is where doctors who desire to practice in Belize do their internship or residency to receive their medical license.
It has been a building process.
We get to practice a lot of procedures, we get to be in surgeries, we get a lot of hands-on experience.
It's just as important as the theoretical part because you can know the theory, but if you don't know how to do what you need to do, then that's the difference between saving a person and causing more harm.
John Waite has been the coordinator of the Ministry of Health and Wellness's medical internship program since its inception just over a decade ago. 182 interns have completed the program under his tutelage. That is just over 30% of 563 medical doctors that are currently licensed to practice in Belize.
It is a period of further training which is designed to prepare the recently graduated medical doctor for safe and independent practice in the nation of Belize. The emphasis being in Belize because medicine does vary a little bit or more than a little bit from place to place. And the idea is to prepare these doctors who've completed their university degree for safe, that they do no harm, as is the idea, and we aim to do good, and independent, in other words, when they go through the door, they're on their own, and can function as a medical officer, for example, in the public service, or they can work as a primary care doctor in one of the NHI clinics, or they can even open their own private practice and see patients.
Doctors Gerald Castillo and Aliyah Abraham underwent their studies in Cuba, while Jean-Marie Young studied in the Republic of Georgia. As they explained, students within these institutions received limited hands-on clinical experience, partially because of how advanced and well-staffed healthcare facilities are within these countries. So, they returned to Belize with a wealth of knowledge, and the medical internship program steps in to provide additional experience under strict supervision.
For there, the different patients, we don't even see them because they go straight to the specialist clinic. But here, we are the ones that have to see those patients and manage and treat. So with that, it has been a great experience to know how Belize does management for those patients.
What does it do for your confidence as a doctor?
Oh, it skyrockets it.
There are four major services in the hospital, the medicine, surgery, obstetrics, and pediatrics, and they spend 3 months in each. The the medical service includes a short stay in emergency medicine and accident and emergency. And then the surgical one is divided in between orthopedic surgery and general surgery. Obstetrics is obstetrics, and the pediatric service includes the neonatal intensive care unit. What do? When assigned to the given service, they are the primary doctors dealing with the patients.
One would consider, all right, if you study overseas, perhaps we are unequipped to expose them to that level of experience and training.
Well, you've hit a chord. When I came back here a long time ago, my supervisor said, "John, you will do well in Belize because you can improvise." Well, we've made strides. It's not quite like that, but at times you just have to improvise. That is one thing.
62% of Waite's interns over the past 12 years are now working in the public service. Others are out undertaking postgraduate training in clinical specialties. Undoubtedly, the internship program is making a significant contribution to the delivery of medical care in Belize. Notably, 7 of the current cohort of interns are women and only 3 are men. According to Waite, there has been a gradual decline in the number of male medical practitioners across the world. Dr. Jean-Marie Young shared her thoughts on why this may be the case.
I would think it has more to do with the social aspect of the country, maybe how women are being pushed more to get an education, to be more independent, versus men. Maybe men have more pressure to sustain their families from a very early age. I think there is a lot more socioeconomic factors relating to that.
Each of these doctors have a different story on how life led them to engage the field in which they are currently employed. But in speaking with them, they all shared a similar vision to improve the healthcare system in Belize. This is evident in Dr. Aliyah Abraham, the first medical practitioner in her family.
Sometimes they tend to say that it's mostly the nurses that are more compassionate towards them.
How much pride do you take in compassion?
A lot. Because that's when you find that your patients would find they would be more free with the information that they have to offer. And then it could help to lead you more to be able to diagnose and help treat them.
Reporting for News 5, I am Paul Lopez.